Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga COVID-19 update. We are live at PAA Western Mindanao Facebook page, One TV Philippines and other partner agencies' Facebook pages, and via cable televisions at MCTV and eMedia. Kukumustahin natin muli ang ating COVID-19 cases and update dito sa buong Zamboanga Peninsula, lalo na meron tayong nababalitang bagong Omicron sub-variant dito sa Pilipinas. Kilalanin po natin ang ating panauhin ngayong araw mula po sa Department of Health. We have Dr. Cheryl Sarmiento. Magandang araw po, Doc.
Magandang araw, Ma'am Myra, and sa lahat po ng nanonood at nakikinig.
Ayun. I'm sure, Doc, yung mga residente po natin dito sa Zamboanga Peninsula ay nagtatanong na rin kumusta po kaya ang ating COVID-19 cases po, update dito sa buong Zamboanga Peninsula, lalo na po ngayon pagkatapos po ng nangyaring eleksyon. Yes po, Doc. Can we know the update po?
Alright, sige po. So, as of May 16, 2022 po, ang Region 9 ay naka-record na po ng total confirmed COVID cases of 60,248. 31 po nito ay active cases, while 57,692 naman po ay naka-recover na. Unfortunately, 2,525 of the 60,000 confirmed cases ay nagresulta po sa pagkamatay ng pasyente. So ito po yung breakdown ng active cases natin ng COVID-19, yung 31 sa region. Nakita po natin Zamboanga City has the highest active cases of COVID-19 with 21 individuals, followed by Zamboanga del Sur with 7 active cases, and then Zamboanga Sibugay, 2, and Zamboanga del Norte, 1 po. We have recorded highest death sa Zamboanga City pa rin po. Alright. So, moving on, etong slide na to, pinapakita niya yung May 16, ilang bang number of specimens ang na-process or na-forward sa ating 9 active na COVID-19 laboratory testing facilities. So, the laboratories were able to process 246 specimens, and majority of the specimens we can see came from Zamboanga City, followed by Zamboanga del Sur with 62, Norte 38, and then 1 specimen was processed from Zamboanga Sibugay. Out of the 246, ilan po ang nag-result to a positive result, no? Good to know po, nung May 16, lahat po ng 246 specimens na process ay turned out to be negative for COVID-19. Okay, so ito naman po will give us information on the current healthcare system capacity. So as you can see, as of May 16, for the entire region, we are at 14% utilization when it comes to COVID ward and isolation beds. We are at 4% utilization naman ng COVID ICU beds, and 1% utilization for our mechanical ventilators. So kung nakikita nyo po, green lahat. All of the figures are in green, indicating yung low to minimal risk ng ating mga provinces and cities in the region. So when it comes to our utilization of our PPMF beds, again, as a region, less than 1% ang occupancy rate natin, indicating again, reflective again of the relatively low active COVID cases in the region and in the different provinces and cities. Okay, so as of May 16, we already have a total of 4,539,810 doses of COVID-19 vaccines administered. Ang breakdown po niyan, yung 2 million ay naging fully vaccinated na, while we have 2 million who are partially vaccinated. And then 301,000 were provided with booster doses. This slide will show you lang po yung breakdown ng ating 4 million na doses administered. base sa priority groups na we identified, whether it be A1, frontline health workers, our A2 senior citizens, our A3 those with comorbidities, our A4 the essential healthcare workers, our A5 yung ating indigent population, and then the rest of the adult population. The next slide will also provide us a breakdown or the number of individuals among the pediatric population in particular na partially vaccinated and yung fully vaccinated.
Okay.
I believe that's the end of our update for everybody.
Okay, thank you very much po. It's good to know po, Doc Cheryl, na yung mga kaso po natin dito sa Zamboanga Peninsula hindi po tumataas or umaakyat po. Pero we are also curious na during the election, I'm sure meron po tayong monitoring sa bawat polling centers natin. So we would like to ask kung meron po ba tayong na-monitor or na-receive po ba na concerns regarding the isolation natin doon sa mismo mga polling centers natin.
So we are happy to actually inform everybody no ang Department of Health was able, Center for Health Development Region 9 was able to deploy a total of 436 human resource for health during the May 9 election. So they were deployed in the different provinces and cities. There was a monitoring conducted, and based on the report from our health emergency unit, they recorded a total of 53 consultations and 6 referrals. But we're happy to note that wala pong report of any individual isolated or quarantined due to COVID-related symptoms. Majority of the reasons for consultation during the election were because of loss of consciousness, elevated BP, headache, and dizziness.
That's good to hear po also, Doc Cheryl. After po ba ng election, are we expecting na meron po tayong surge of cases or may possibility po na tataas yung mga kaso natin, especially with the new variant o itong ating Omicron sub-variant po na nakapasok na rin sa bansa?
Based on the current data that we have, so the week prior to the elections, we had 3 average daily cases for the region. That's from May 2 to 8. Then the week naman po, the latest week natin, yung week 6, that covers May 9 to May 16, 2 average daily cases naman po ang na-report natin. But we continue to monitor, no, and we gather daily information so that we'll see if there's a need to implement stricter interventions or measures para po ma-prevent yung spread. Gaya nga po ng sabi niyo, because of the presence of variants of concern, like the Omicron.
Yes. Doc Cheryl, can you tell us about the new variant? Do we need to worry about it po ba? Ano po ba yung difference nito sa mga naunang variant din na na-record or naitala natin here in the Philippines?
Okay, so I would like to share po on the actually press release provided by our Central Office Department of Health. No? So the DOH, after careful assessment of available data provided by the University of the Philippines, Philippine Genome Center, and the UP PGC Visayas, as well as the RITM, and the regional and local epidemiology and surveillance units, they confirmed the local transmission na po of Omicron subvariant BA.2.12.1, 2.12.1. And cases have been detected in the National Capital Region, Western Visayas Region, and Puerto Princesa City. So, local transmission means that local cases have been detected na po, no, which cannot be epidemiologically linked to cases with significant international na travel history. And the most recent evidence indicates that Omicron BA 2.12.1 is highly transmissible due to additional mutations compared to the original Omicron strain. And while this sublineage has so far not been observed to lead to more severe disease or fatality, it has the potential for immune response. So, ang sinasabi po ng Department of Health, i-reiterate po namin dito sa regional office, na now that we have a local transmission po of Omicron BA 2.12.1, we must act fast po. That's why we are requesting our health facilities and local government units to really continue to actively look for cases. The usual naman po, no, we need immediate isolation. Ang advice natin is immediate isolation for any person who has fever, cough, cold, sore, or itchy throat, and other COVID-like signs and symptoms. We are emphasizing that the local government units should be able to conduct response operations following yung mga established na po na strategy provided to them, utilizing also the available tools na meron po on how to prevent further transmission. So should we worry? I think what we must do is continue to continue to adhere to the minimum public health protocols. And if we can reiterate the message of our Secretary of Health, Dr. Francisco T. Duque, ang sabi niya po, we are actually in a better position now to fight back against COVID-19. So ang Department of Health, through the Centers for Health Development and the local government units, is now priming laboratory networks, temporary treatment and monitoring facilities, clinics and hospitals to be ready. We must all follow the health protocols, wear the best fitted mask, isolate when we are sick, and choose good airflow. And while the cases are low and the healthcare capacities are not overwhelmed, now is the best time to be vaccinated and get boosted as soon as eligible.
We are talking about vaccination natin po, Doc. Ngayon po, we can see that still majority or most of the municipalities, provinces po dito sa Zamboanga Peninsula ay nasa alert level 2 pa rin. And of course, isa sa mga dahilan nga po is hindi pa nila na-reach yung target number of their vaccination rate doon sa kanilang mga provinces. So, kumusta po yung ating vaccination program? Makikita na po ba natin na malapit na po ba tayo sa ating herd immunity here in Zampen?
Thank you, Ma'am Myra. So we say herd immunity, also known as population immunity, is the indirect protection from an infectious disease that happens when yung population is immune na either through vaccination or immunity developed through previous infection. Dati po, we have been hearing about, we know herd immunity from measles vaccination, from polio, no? But actually, for COVID-19, we are still learning pa daw po about immunity to COVID-19. Especially given na this is a new disease and then our vaccines are also new. There are emerging variants which impact also yung effectiveness ng ating vaccines. So until we better understand COVID-19 immunity daw po, it will not be possible to know kung ilang percent pa talaga of a population is immune and how long that immunity lasts for. So wala pa po tayong percent threshold for COVID-19 herd immunity. But we are guided by the set targets ng Department of Health Central Office. So for our country, we are targeting po sana na 70% of all eligible population in the country will be vaccinated, and that's around 90 million. But for June 30, ang wino-work po natin lahat is that 77 million of all Filipinos will be fully vaccinated by June 30. So may mga may mga identified targets na po yan per province, per city, and per municipality. So that's up to June 30. And ang guidance pa po na binigay sa atin as a target for the COVID-19 vaccination is that we want 70% of our total population ay fully vaccinated, and 70% of our target senior citizens, which is estimated, yung senior citizens estimated to be 85% of the total population, ay sana fully vaccinated na din po. So, I hope we are guided by etong mga targets din. Our LGUs are guided by these targets to reach them so that ma-protect natin yung kailangang ma-protect. We all know based on our learnings no from COVID, the 2 years now we were dealing with the COVID pandemic na yung being fully vaccinated, while it may not fully protect you from getting infected, it provides excellent protection from from either being hospitalized, being admitted in ICU, or even from dying. So, we say very important po, we grab this chance na to really get ourselves vaccinated and get the booster shots na binibigay po, available sa ating mga health facilities.
With that, Doc, do you have any announcement po ba or meron po tayong panawagan sa lahat po ng ating mga manonood ngayong araw?
Yes. Thank you, ma'am, for the opportunity. So, with regards to COVID vaccination pa rin po, we are having special vaccination days, no? Ito po yung last day for the month of May. But on June, meron po tayo again special vaccination days. 3 days in a month na our local health units are focusing on meeting their targets, vaccinating eligible individuals, ramping up yung 5 to 11 na vaccination. So I hope our community people will avail of all of these services, no? And at the same time, medyo may mahaba-haba po kaming closing remarks. If I may po, ma'am, no? So we'd like to thank everyone who exercised their right of suffrage, especially those who followed the minimum public health safety protocols. Now more than ever, we must focus all of our energy on defeating this pandemic and the challenges associated with it. Nothing is more important than ensuring the health and safety of our community, of our loved ones, of our workforce. So our fight against COVID-19 is not yet over. And in this time of new normal, we hope that everyone will continue to observe the following minimum public health standards to protect themselves and even their loved ones po. So kindly wear the advised proper face mask and face shield at all times. Face shields for those indoors or those in the hospital. Maintain the physical distancing. Frequently wash hands and disinfect your hands. Avoid high foot traffic and crowded places. Get vaccinated as soon as it's your turn and follow local guidance on vaccination. And if you develop symptoms or test positive for COVID-19, follow protocols and guidelines also. Self-isolate until you recover. Contact your healthcare worker. No? To make your environment as safe as possible, we remind everyone to avoid the 3 C's, yung closed spaces, crowded spaces, and those spaces that allows you to have close contact with other people. So we can meet people outside, the better. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. All right. And then, if you feel unwell, I hope at this time our families, our health facilities have already disseminated their hotlines kung saan sila tatawag. If I feel like I have COVID symptoms, so I will coordinate, contact my BHW, my BHERTS, Yan. But if you have a fever, cough, and difficulty breathing, please seek medical attention immediately. And stay home if you have nothing else to do. Stay home because it's safer at home. And then please keep up to date on the latest information. And we encourage everybody to get information from reliable sources, just not hindi lang po saan-saan from the internet, but either from your local health authorities or national health authorities. Ayan. So thank you very much po for your continued support, and it means a lot po to all of us in the healthcare system. Together po, only by being together, working together, will we be able to get through this pandemic. Magandang hapon po.
Okay, once again po maraming salamat po Doc Cheryl Sarmiento, and of course maraming salamat din po sa mensahe sa lahat ng ating mga manonood. And yun, mahalaga pa rin po na pinapaalalahanan natin yung lahat, na meron pa rin tayong pandemya, so patuloy pa rin yung pag-follow natin sa ating mga protocols. So with that, again, maraming salamat po sa Department of Health. Thank you very much po Doc Cheryl Sarmiento for your time and for this opportunity. And sa buong DOH po, maraming salamat. Magkita-kita po tayo sa ating next COVID update po, Doc. Maraming salamat po sa lahat po ng ating manonood, and of course, sa mga viewers po natin ngayon online. Tumutok lamang po kayo sa PIA Western Mindanao para po sa mga update pa po natin, especially regarding our COVID-19. Maraming salamat. Ito po si Myra Espinosa para sa Kapihan, Zamboanga, Chanekidao, Ustedes.